I have a number of slides, trying to keep with some fidelity to the 15-minute time frame of the didactics, and then certainly staying on for questions thereafter. There should be a copy of the slides that I had sent to the organizers, and you're certainly welcome to have those. And I hope this is a part of a broader conversation. Obviously, talking about supporting students in schools is a pretty complex topic with both practice considerations, but a lot of legal considerations as well. So this will be the first of hopefully several conversations towards that end. I do want to begin by sharing my presentation, and if I can do a quick process check that everyone can hear me, and you should see the opening slide that says 5 keys for accessing student supports.
Looks good.
Sounds good. So again, I'm Erich Merkle. I serve as a central office school psychologist for Akron Public Schools. This is an area of passion work for me, and it's an area that I train not just around Summit County, but also nationally. And the idea of helping schools and social service and medical systems collaborate effectively comes from an interest in my former life as a therapist through present day. I also have a couple scholarly books and chapters on this very area. So if you ever need resources or supports or infographics or something, certainly feel welcome to reach out to me. And if likewise, I can help your agency in trying to navigate the complexities of our shared systems of work, don't ever hesitate. I'm certainly glad to be a resource to you. So very quickly, my agenda, I have 5 keys today, which is grossly simplifying a lot of processes, but I do want us to understand just a little bit about getting help, who's responsible, talk a little bit about the idea of scientific or evidence-based interventions and pre-referral interventions, and then what is kind of in some very, very hastily broad strokes, the difference between Section 504 and the Americans with Disabilities Act supports in schools versus special education, and then the idea of the continuum of services. And as I said, depending on where this team wants to go, I'm more than glad to come back and we can kind of do a deeper dive in all of these respective areas. So hopefully if I do my job in 15 minutes or less, you'll have some ideas about the pathways towards getting supports for students in schools, whether they are your own clients or patients, or they are perhaps even family members or those that you support in your own life. And then hopefully also offer at least some clarity of thought between the differences of special education and Section 504. So I'd like this to start with the idea that we spend a lot of time going back and forth as educational providers and community providers, talking about places and all kinds of different services and supports for students. It's important to understand that when we're thinking about this from the educational arena lens, we are always talking about what are the programs and services that a student needs to achieve educational success. And our concern is really looking multidimensional at a student being able to access curriculum, make progress, and to do so in a non-discriminatory way. But the emphasis is on what's programs and services that are going to make that happen. Many times these conversations evolve into requests from providers for evaluations or IEPs or 504 plans. And if you don't know what that means, stay tuned. We'll hopefully offer a little bit of insight into that. Or it's demanding placement at this or that program, school, a residential program in Scotland, you name it. It kind of comes up in lots of different ways. And so understand, though, at the base level, we are not talking about a place. And that is one of the first key takeaways here is when we talk about comprehensive student supports, we are not talking about a magical place. There are no pearly gates that open. There are no staircases to heaven or somewhere else, perhaps, that open or that you ascend or descend in getting student supports. It is about the programs and services. We also have to understand that in many cases, supports for students really can be accomplished through rigorous, high quality interventions within a traditional classroom setting. Now, I don't want anyone leaving this didactic session and saying, well, Dr. Merkle said that special education or Section 504 is not where you should be going. It doesn't work. What I would say is if you get into the meta-analytical literature, like of scholars like John Hattie and Visible Learning, he will tell you very quickly that the effect sizes of special education are negative and they are not particularly robust. Again, that's in mass, in group, looking at meta-analytical data points. What I would say, though, is not to take that and run with it and say that special education or Section 504 services and accommodations don't work. I'm not offering that. I'm just saying that that's not always the only choice, and it's certainly not always the best choice. So we really do need to calibrate how it is we support students. It's also complicated further because there is so much legality. And in fact, when I transitioned from being a therapist coming into school-based practice, I thought, whoa, maybe I'll get a reprieve from all of the behavioral health paperwork demands, charting, and everything else, only to learn that what we have is just as much, if not more in many cases, in the educational arena and in the practice of school psychology. But more than that, so much of what we do and sometimes what becomes points of conflict is the legalities. And as my dear colleague on here, Marjorie Cook, knows, the legalities really are the ultimate complication. And sometimes what decisions we have to make or the things that we do that don't always sometimes make sense or seem like we're overly complicating things or being resistant or creating barriers is actually a function of various federal and state statutes. And included in that is who is actually responsible for providing help to a student in any situation. Now, this type of content I give in a multi-hour, sometimes day or 2-day long presentation. So bear with me very quickly. If you are working with a client or student and they attend a public school, like Akron Public Schools, Cuyahoga Falls City Schools, Kent City Schools, that is the school district that is going to be responsible by and large for providing services and supports. Understand, though, that if a student attends a charter school in Ohio is considered to also be its own public school. In essence, they are their own school district. That charter school then becomes responsible for providing the services and supports. So charter schools or community schools, depending on which terminology you want to use, are their own public school districts as well. Now, parochial schools get a little more complicated. Parochial schools, there are some supports that can be provided, especially under Section 504 and ADA, if that parochial school is a recipient of some sort of federal funds. That is, maybe they have title monies coming in, free and reduced monies coming in. Also, even if they get transportation from their local school district, that is a flow through of federal monies. That does oblige them to follow Section 504 and ADA. However, if they're a parochial school that has no flow through funds coming in, they may not have any responsibilities. Equally so, as one of these inflection points of confusion is that special education services still belong to the public school within which that parochial school exists. So for example, if we talk about Holy Family in Stowe City Schools or Stowe Monroe Falls Schools becomes the responsible entity to provide those special education services and supports such that they are available. Now, independent schools are even more complicated. For example, Western Reserve Academy is an independent school. It exists in Hudson, so Hudson City Schools becomes responsible for a lot of their services and supports as they are available. Now, homeschooling is an important conceptual term. A lot of people talk about their child being homeschooled, but this always means that you have to pause and kind of query, what do we mean by homeschool? For many folks, that means that their child is actually participating in virtual instruction. That is not homeschooling. Virtual instruction is provided either through a charter school, which is again a public school like Odella, or it could be a relationship that a public school district has to provide their own online school, like we do in Akron, which we call APS Online. Proper homeschooling means as a family, you have asked the superintendent of that public school district within which where that family lives for an exemption from compulsory education demands. And that means as a family, you are saying, I would like to provide all the educational services to a student. And homeschooling gets complicated because by definition, that family has asked for an opt-out from participating in public education and the compulsory education demands. Now, that type of outreach still belongs to the public school district within which where that student lives and attends. However, by and large, any services or supports thereafter are going to require that that student pivot away from homeschooling and re-enroll into a school district. And then finally, probably one of the most confusing area is court-placed students and students who are unhomed or displaced. Court-placed students, typically students who are considered wards of the state, that is Children's Services or a child welfare agency, has temporary or permanent custody and has a student attending in a different school district than the school district of residence. That becomes a shared activity between the child's district of residence and what is identified at that time as the district of service. And then both districts work collaboratively in supporting that student. So it is important to understand where the student attends as a context for knowing who is by and large going to be responsible. Now, everything we talk about when it comes to supporting students is on this idea of the continuum of services. Again, going with the spirit that we are talking about programs and services and not places, now I have to talk out of the other side of my mouth and talk about what we refer to as the continuum of services. We organize these continuum of services along a horizontal axis of least restrictive to most restrictive. And what that means is to what degree is that student with his, her, or their neighborhood peers and his, her, or their neighborhood school and accessing general education content. As you manipulate those variables, for example, maybe the student is in a small group setting, or the student is not in the neighborhood school, or perhaps the student is attending a completely different school environment altogether, you become more and more restrictive. The bottom of the screen shows all the different stops along the continuum in regular education, starting with regular education that most of us are familiar with in some capacity. You sit in a classroom with your neighborhood peers, typical students, you receive instruction all day. And then you move along that continuum as students need help, including things like extra classroom supports, which are going to be the rigorous high quality interventions, the land of Section 504 accommodations, that is also in regular education. Then we get into things like alternative programs, partial hospitalization, inpatient programs, home instruction, and yes, even incarceration. And students continue to have a constitutional property right to educational services, even if incarcerated. At the top of the screen, and the shade of blue, depending on your monitor's color, is the continuum of services for special education, which includes things like tutoring, cross-categorical services, which many districts talk about the expressions of push in or pull out, meaning we're pushing in educational services, teachers, providers, or we're taking a student out to other classroom environments. We have small group settings. Sometimes you might have heard them in the past called units. A lot of times they're for students with more notable disabilities like autism, emotional disturbance, multiple disabilities. Then there are alternative schools. There are temporary placements for students who transact certain violations against a student code of conduct. Again, partial hospitalization, contractual placements, residential programming, home instruction, and yes, incarceration. So we are always thinking about, when we are looking at student supports, where does a student need to be supported along this continuum? Now, one of the great points of frustration and difficulty is the idea of providing interventions and supports. It's important to understand that a school-based evaluation is not an intervention. It is simply a data collection activity to see if a student qualifies for other services such as Section 504 or special education. The evaluation in itself, though, is not an intervention. And again, going to that spirit that sometimes special education in Section 504 is the right solution and other times it is not, we always want to begin with trying to put rigorous, high quality interventions in place. Now, when I'm saying that, I'm not saying things like preferential seating or extended time, which a lot of districts unfortunately misconstrue as those types of interventions. I'm actually talking about decisive reading interventions or decisive behavior strategies. And for many students, that is all they need to be able to continue to access curriculum and make progress. Some terms you'll hear is the idea of response to intervention, which is a way for a school district to collect data using these types of interventions and seeing if they're making a difference. If they are, great. Maybe we just do more of that. If they are not making a difference, we need to pivot, or that tells us we really do need to be looking at more restrictive services along that continuum of services I just showed. Also understand that sometimes frustrations come up between providers and families and school districts when there is this push for an evaluation and school districts say, well, hold on, we have to get some data. Now, understand under law, there's not supposed to be a delay in requests for evaluations. However, school districts also are in the bind that they have to show that they have tried to provide interventions to see if that makes a difference and how the student responds. In fact, that is a required component on the evaluation forms, and it's something that every school district is progress monitored and checked with both at the state and the federal level. So it's not even an option that school districts can't do that. Now, in addition to providing rigorous high quality interventions, there are certainly going to be plenty of students. The nature of their disability or the severity of their needs requires far more. And that takes us into two other domains, one of which is called Section 504, and it's contemporary, the Americans with Disabilities Act. And the other pathway is special education, which is called IDEA, the Individuals with Disabilities Education Act, or its contemporized, reauthorized version, IDEIA, the Individuals with Disabilities Education Improvement Act. So special education, IDEA or IDEIA, civil rights protection, Section 504. Now let's talk a little bit about that idea of civil rights. Civil rights is the idea that we are trying to uplift and support marginalized, minoritized, or disenfranchised individuals in some aspect of community, access, participation, engagement, including the school process. So Section 504 is very different than anything else we look at in education because it's not an education-specific statute. Actually, Section 504 involves lots of context, as does its contemporized version from 1990, the Americans with Disabilities Act. Again, these are all about prohibiting discrimination in areas and programs and activities that receive federal monies of some sort. So again, schools are netted into Section 504 and ADA, but it is also in areas such as access to public services, housing, and so many other domains. Section 504 is always about non-discrimination and access to school. That is it. Section 504 does not expound upon itself to provide lots more robust services like special education does. Special education is uniquely to public schools, and special education as a federal piece of legislation ensures that students are able to receive specially designed instruction and related services at no cost to them in the least restrictive environment, and is exclusively for the educational arena. Now, kind of breaking this down a bit more. As we talk about special education, it's important to understand that this refers to students who are ages 3 to 22, that is, including preschool, all the way to the 22nd birthday. Now, understand that special education does not go into higher education settings. That takes us back to Section 504. However, students can stay in their public educational arena beyond age 17, 18, when many students would graduate, based on the severity of their needs if they continue to need to access special education services within their preschool to 12th grade setting. Again, that stops at the 22nd birthday, and depending on the student's need, not as common of a practice, but it is certainly for some students a substantial lifeline and a way for them to continue to receive services. Also understand, special education has its own diagnostic, or nosological system that is codified under the federal statute. And many providers don't understand this idea. They think that an ICD or DSM diagnosis equates to eligibility. It does not. There are 13 areas of federal disability category recognized for special education. These range in areas from autism to traumatic brain injuries, specific learning disabilities, speech and language impairments, deaf blindness, and so on. Every student who is evaluated for special education, the question is, does that student meet the federal criteria? Now, it is a whole separate conversation and presentation. What does it mean to have an educational classification of a disability versus a medical or behavioral health diagnosis of a disability? Those are two discrete, separate entities. Sometimes they overlap, sometimes they don't. Understand, special education is always about giving specially designed instruction, that is, those special education services or related services, which are things like speech therapy services, occupational therapy, audiology services, maybe braille or visual impairment services. Special education has some level of federal funding and state funding. The original intent in the early 1970s is that special education would be fully funded. The reality is it's more in the range of 20 to 30 some percent. In contrast is that Section 504 civil rights part. This, because it is not education specific statute and involves lots of different domains across society beyond the school setting, is a birth to death statute. It only has one very broad definition, that you have a physical or mental impairment that substantially limits an area of major life functioning or bodily functioning. So there are not discrete disability categories. There are not specific nosological systems. It is just a physical or mental impairment that substantially limits an area of major life functioning or bodily functioning. Section 504 is about accommodations and services. It is not about specially designed instruction. In fact, that is the key distinguishing characteristic. If you are working with a client or a patient, and you know that student needs specially designed instruction, that pivots you down the pathway of special education. If the student needs accommodations, that is where Section 504 is important. Section 504 also does not provide one-on-one services. For example, you would not put a speech therapist on a Section 504 plan because there's no annual progress monitoring. And again, it's about non-discrimination and it's about access. It is not about progress in any way. It's also important to understand that Section 504 does not afford any type of federal funding. Breaking it down a little bit more. Special education always involves comparing the student to the student. That is, we want that student to make progress. In fact, the whole point of special education is that you're reasonably calculating services to produce an educational benefit. That's, in fact, the outcome of a recent Supreme Court case called the Andrew case, and that's the Andrew test. It is always about making progress. It is about ensuring that the student is receiving curriculum, related services as they are needed. Understand that special education is a complex process involving a document called an IEP or an individualized education program. That is sort of the guidebook that supports how a student receives special education. It is always results oriented. That is to say, is the student making progress based on the annual measurable goals or not? In contrast, Section 504 is non-discrimination and access. It is comparing that student to students who do not have some form of physical or mental impairment. Again, it is accommodations, which refer to how a student demonstrates or accesses learning, or certain services. For example, it might be transportation to school because of a medical condition that makes it precarious for the student to walk or take maybe a bus in a traditional sense. It is completely silent on the idea of whether or not a student should be making progress. It is also silent on areas of things like grades and so forth. In fact, a lot of times when I sit in Section 504 meetings and there are conversations about, well, my student's failing, Section 504 isn't working. That's not the right conversation for Section 504. It certainly is an appropriate conversation for special education. Section 504 is your child being discriminated against? Does your child have access to school? Now, taking all that information, this is a much broader tabular presentation of all that. So again, when we talk special education, I very much want you to understand that there is a three-part test that we are always looking at. So for a student to actually qualify for special education, we are talking about a student that meets one of those 13 areas of federal and/or state disability, and that there's a need for special education. And special education statutorily is defined as adapting to content delivery or methodology of instruction. And in fact, if the student does not need the content delivery or methodology of instruction adapted in some way or modified, that really does preclude the need for special education. And there has to be evidence of what we call adverse educational impact. Now, this is not a concept that's quantified. Adverse educational impact really does mean something different in the eyes of many different individuals. Typically, we look at it from the standard of a student is performing sub-averagely, if not failing. The student is not able to access school, perhaps because of behavioral mental health issues, perhaps because of issues like discipline. Or it's a student, for any number of reasons, that has behavioral challenges during the day or social emotional challenges that restrict or inhibit access to curriculum during the day. Or it's a student who has irregular attendance for any number of reasons. It could be behavioral mental health, it could be health factors. And every evaluation is trying to answer those three questions of that test. Notice again what it does not say is provider gives a diagnosis and that automatically opens the doors. It does not. It can certainly create what is called a child find duty for a school district. What it does not do, though, is automatically result in eligibility for special education because the school district has to answer those three questions of the test. Understand that special education is roughly 15% of a school district's population. This is in contrast to Section 504. Again, civil rights, very broad definition of that physical or mental impairment that substantially limits an area of life functioning. That idea of being substantially limited is equally so something that is not defined. However, it does speak to the conversation of whether or not that person can actually do that life activity or perform that bodily function compared to others in a way with or without accommodations. Generally, about 2.7% of the population of a school receives Section 504 accommodations. Now, with that, that takes us into probably the question and answer period because I want to have fidelity to the 15 minutes and I don't want the proverbial chain taking me off the stage here. So with that, I am going to conclude with my contact information and I'm going to stop my screen share so that we can pivot back into conversations.
Dr. Merkle, that